Welcome back. India's active coronavirus cases have climbed to 5,700, with Kerala leading the surge with 1,806 cases. The surge in cases is also being reported in Delhi, Bengal, Maharashtra. Official data shows a total of 59 deaths in the past few weeks, and in the last 24 hours, 4 people have died. Most of the cases, although, are mild, and there is no need to panic. But surge is also happening across the world, with countries like Thailand reporting 20,000 cases in a day. So what should you do if you suspect COVID? Is a booster shot of vaccine recommended? Let's address all these questions with our expert. But first up, we are joined by Dr. Naresh Trehan, who is the chairman of Medanta. Dr. Trehan, appreciate you taking out the time and speaking with us. Well, sir, although there is no panic now, cases are rising every day. Should we in any manner be worried about a peak?
So certainly we are worried as healthcare providers, we are very worried, but the point is not to panic right now, that is correct. So what we are saying today is that, look, you have to be cautious, exercise all the techniques that we talked about at the time of the COVID wave, about separation by 6 feet, taking precautions of not spending too much time talking closely to any individual. Third is to anybody who has a cold or a cough, we are advising today to isolate themselves for at least 5 days so that the people who are close to them do not get infected. But if that cough and cold is accompanied by fever, then they should get their COVID test done also. And that 5-day isolation that we talk about, at least the last 2 days of those should be without fever. So these are the minimum precautions we are advising people to take right now. We know that it is so far we know that it is a subvariant of Omicron, and some variants have been identified like JS1 and J1 and all that. The basic thing is that we should be aware of the fact that COVID is spreading. We also know that most of the cases are mild. And we also know that the variants which they occur from one, that because it's a variant of Omicron, that usually they are milder. Now, what is left today to understand is that what the gene sequencing that is being done by the government laboratories will tell us that is this gene, in case it increases and becomes rampant like an epidemic, is the current vaccines that we were using before, are they effective against this or not? So do we have time? And so this is being tested right now. So we are saying right now that we don't know what the effectiveness of this vaccine is, so we are not recommending that people take the vaccine today. We should wait till we have a determinant of how rampant this will get and how most people will recover, and whether by the testing, whether this variant is actually controllable by vaccination. So these are question marks which are open right now. But coming back to the fact that you have to be taking care of your nutrition, that you are healthy, you need to exercise to build your immunity, and also cautious about the recommendations for in times of COVID, that we should be exercising them today.
Hey, Dr. Trehan, what are the first indications of catching the current COVID strain according to you?
It's basically, most common thing is a sore throat, a raspy throat, along with fever, then follows, and some people will get it, some people will not, but most people will get fever after a raspy throat and a cold. So anybody who has trouble swallowing or has a sore throat should be cautious, get yourself tested, so that and it's simple enough to get yourself tested, and you will know whether you have COVID or not. If you do have, of course, you'll isolate yourself immediately, but people who have persistent cough and cold right now with fever, we are recommending that they self-isolate themselves, but they should get their test done also, so that we know that how rapidly is it spreading or not spreading, and how to protect the family members and the surrounding people who are associated with that person.
And so what would your advice be to the people who are seeing these symptoms? What should they do?
So I'll repeat that basically it is spreading, no question. Maharashtra has over 550 cases. Noida also is showing some signs of increase in numbers. In Gurugram, that we saw in our own hospital, we had about 23 patients, most of them very mild. 2 of them required ICU because of the fact that they have pre-existing lung disease. So today, if you take the warning, 1, everybody should be cautious. Second, especially those people who have pre-existing lung disease or heart disease, they are more vulnerable. And people who have diabetes, which is of long standing, also their immunity is low. So all of us must actually make sure that we are getting enough nutritious food. We are exercising at least 4 to 5 times a week, at least 4 kilometers of brisk walk or any other exercise that is equivalent, so that your muscle mass stays okay, your immunity stays intact, and that is because of this fact that this is an Omicron variant that we are hoping that it is going to be very mild, which is so far the indication. Only there have been 54 deaths lately reported in the country. Now, the analysis is being done. Are they more, those people who are more comorbidities they have, whether they are the ones who are victims, or is it like in the general healthy population also it is virulent? So all these things will clarify themselves in the coming days, but in the meantime, one can protect themselves. Everybody should try to protect themselves and stay away from people who have a cold or a cough or a fever, and also avoid crowded places.
And so would you recommend a booster shot of the vaccine again?
No, as I said earlier, we are not recommending it right now because we don't know whether the previous vaccine is effective against this one. We don't know what is going to happen in the future. It is a possibility that, like we recommend flu shots for elderly people or comorbidity people every year, that this may be also part of the vaccination system in the future. But this is not clear right now. The outcome is still to come because the genetic analysis, the gene sequencing is being done to all the variants that we are finding, and we'll know whether they are actually susceptible to the vaccine that we were using before. So just wait. This is not recommended right now by us.
And is India better prepared, you think, for hospitalizations since the Omicron variant spreads quicker than the other strains?
Yes, it is true that because we have had experience with it once, and I hope we don't have to repeat it, but if it is required, we can very rapidly, most hospitals can very rapidly repurpose themselves to deal with COVID patients. So, like I said, I hope it doesn't reach that stage, but if it's needed, then we can all actually respond very quickly like we did the last time.
Dr. Trehan, appreciate you joining us, sir. Thank you so much.